say lupus stole the color from your days, but Tina, you still planted light in every way. Hand in the soil, hope in the rain, growing kindness where there once was pain. This is Tina's garden, where love won't fade.
Alright.
Petals of courage in the shade.
Everyone around. We are indeed grateful for everyone who's going to tune in for our podcast. And we are kindly asking if you can just share the link, or rather the video. For those who don't know me, my name is Nyirongo, and I'll be the one handling the questions for this podcast. It's a rare privilege and honor to have this podcast today in honor of our beloved sister, Nyirongo, who indeed went to be with the Lord this very day, 7 years ago. And with me, I'm with our guest speaker, Dr. Lambwe, who later on will introduce himself. We also have our sister, Kunda Chanda Abigail, who also later introduced herself. With me also with the CEO of the Kelvin Nyirongo Foundation, Mr. Kelvin Nyirongo. And mostly we want to also make mention that we are deeply apologize for the late podcast, which was scheduled to start at 11 due to unforeseen circumstances. Good morning, sir.
Good morning, Mr. Nchito. Thank you.
Rather, good afternoon. Sorry.
Good afternoon. Yeah, I was supposed to have started in the morning,
Yeah.
but due to technical issues, we're starting now.
So maybe if you can just introduce the guest speaker and also introduce yourself, who you are and what you do for the foundation position. Thank you so much.
Thank you so much, Mr. Nchito, for that. Kelvin Nyirongo is my name, and I am the CEO of the Kelvin Nyirongo Foundation. I basically call myself as a community worker. I do community work. That's what I do. And it's a rare opportunity for me to call upon Doc to also introduce himself and just tell us a bit about who he is. And then later we'll ask Abigail to also introduce herself and tell us who she is. Doc, please.
Thank you, Mr. CEO. My name is Nelson Lambwe. I'm a medical doctor. I am a physician. By physician, I mean a doctor who is specialized in the treatment of medical diseases. I'm happy to be here and be part and parcel of this activity where we seek to remember our sister Tina, who went to be with the Lord 7 years ago. Thank you.
Thank you, Doc, for that introduction. Abigail?
My name is Abigail Chandakunda. I'm very grateful to be here today. Thank you.
Thank you so much for being part of us. Doc, you know we are behind time. We're supposed to have started at 11 a.m. sharp, but due to technicalities, we're here. So today we are basically honoring our late sister, Tina Nyirongo, like we have all heard, who went to be with the Lord today. And we're raising an awareness on the disease that took her, which is lupus. So, Doc, we just want you to give us an overview. What is lupus? That's what we want to understand for a lot of people who are hearing this word for the first time, just like when our sister was diagnosed, we heard of it for the first time, and I'm glad that while she was sick, you and me were part of that. I was running around with you, just trying to help our sister. So we're glad that you are here. So today we just want you to give us an overview on what is lupus.
Thank you, Mr. CEO, for the opportunity to talk about lupus. Lupus, as it is often called, is just the short way of saying SLE, or systemic lupus erythematosus. When we talk about lupus, it is a disease condition that is autoimmune in origin. And when we talk about autoimmune, what we mean is that the immune system, okay, we have soldiers in the body that attack viruses, bacteria, and other disease-causing organisms. So instead of the immune system attacking the foreign substances that have come into the body, there is actually confusion, and you find a situation where the immune system starts to attack the body cells and tissues, and almost all the organ systems of the body can be affected. The brain can be affected. If the brain is affected, then a patient presents in a particular way. The heart may be affected, the skin, the joints, the bones, the kidneys, the blood cells, really almost all the body systems can actually be affected by SLE. But the commonest presentation most of the times is involvement of the skin, where you have rash that worsens, especially when someone is exposed to sunlight. You have rash on the face, that takes a butterfly appearance across the nose and on the cheeks. But then you may have someone presenting with a fever. Apart from fever, you have a patient presenting with tiredness. You have a patient presenting with joint pains as well. These are the commonest mode of presentation that usually alert the healthcare workers to say, let's look for lupus in this particular patient.
Thank you so much, Doc, for that. I think before we could jump to Abigail, who's a patient with lupus, and we're glad that she's also here with us, who's going to give us an experience. We just want to find out, Doc, with that explanation that you have said, how can one acquire lupus? Is it through interactions? Is it genetic? Is it what? We want to hear that on how one can acquire lupus, Doc.
Okay, thank you, Mr. Nyirongo, for that beautiful question. So lupus comes as a result of interaction of a number of factors. The people that get lupus, most of the times, they are genetically predisposed to having the disease condition. There are some genes that sit usually on the X chromosome, and when one has these genes, it takes certain environmental factors to be at play and interact with these genes to bring about lupus. And some of the factors include ultraviolet light, so that if someone is being exposed to the sun time and again, and they have these genes, then the chance of developing a disease called lupus becomes very high. But apart from that, you have some other factors, such as certain drugs that we give for certain disease conditions, drugs that are given, for instance, in tuberculosis. There's one drug that we call INH. It can predispose to one having lupus. But apart from drugs, it's just certain hormones, okay, such as estrogens. And it's for that reason that you have the females, okay, more of females having SLE than males. In fact, for every 9 females that develop SLE, you have 1 male developing SLE, so that the ratio is 9-to-1 for females to males that would develop SLE. Okay, so it's genetic factors as well as environmental factors. Okay, environmental factors, we're talking about sunshine, okay, the ultraviolet rays from sunshine. But apart from that, we're talking about drugs. Apart from drugs, we're talking about hormones such as estrogens. Okay.
Oh. Wow.
Yes. Doc, before I can go on, I'll just gotten some reviews that the volume on our podcast is not up. I hope the technical people are working on it. I hope the technical people are working on it. We've gotten some response that there is no volume, but to our viewers, also we want to announce that we'll also post a live video after this, in case there's something that you have missed. We're going to have a live video that is going to be posted. So before I get to my brother, Mr. Chito, to ask other questions, we just want to have an opportunity to speak with Abigail. So Abigail is one of the patients, doc, that we have who has lupus, and we are glad that she has joined us today to just share her experiences, and then we'll go on and interact with her as we are still on this session. So Abigail, we just want to find out from you, when did you discover that you have lupus?
I was diagnosed last year in September. Yes.
Okay, last year in September. How did you know that you had it?
At first, I did not know I had it. I got sick and it was very bad, yes.
Okay.
So I was admitted to the hospital. During that time, the signs and symptoms, so I was later diagnosed with lupus.
Okay. Okay, so were they, before they gave you the actual diagnosis, were they other wrong diagnoses that they were giving you, or
Yes.
how was your experience?
I went to the hospital first. I was told I have an infection in my bloodstream.
Okay.
Again, they told me that I have malaria. It was just malaria, but it wasn't.
Okay. Okay, well, I think it reminds me how it was with our sister. We had a lot of wrong diagnosis at the first before they could realize it was. Now, tell us, Abigail, how's been your experience for the past 1 year with lupus?
It's been a struggle, I won't lie. Lupus is a very difficult disease to deal with. Yes.
Okay.
Moreover, looking at the point whereby you're just finding out that you're sick.
Yes.
For me, it was a very big struggle. The change in weight, the medicine, because I have a lot of medication to drink. Yes.
Okay.
It's also been difficult finding the same medication because lupus medication is not everywhere.
Okay.
It's very scarce to find.
Okay.
Yes.
Yes.
Also, let me say, when it comes to, like the doctor said, joint pains, tiredness, all that, yes. Those are some things that I go through almost every day. So there are bad days and there are good days. Yes.
Okay. So, on your bad days, what happens? Can you share with us what you experience on bad days?
Like he said, being in the sun, for example, maybe the rashes, like he said, yes. So sometimes I have rashes, which is called butterfly rash. Flare-ups, like my legs get swollen. I'm very tired, fatigue, brain fog. Sometimes I can't remember a lot of things, yes.
Okay. So do you have situations where you have to, when you have your bad days, do you have situations where you have to go to the hospital, admitted, or what? Or it's just treated at home?
Not really. The medication I'm given, so when I just take the medication, rest a bit, I'm okay. It's not that bad whereby I get admitted to the hospital. No.
Okay.
Yes.
Okay. No, that is good. Okay, we are still interacting with you. There are still more questions that we are going to ask you as we go on. I'll chip to my brother to just get to ask Doc some further questions.
All right. Thank you so much, Chanda, for that. I mean, it shows how strong you are, and just shows that you are ready to overcome this condition. I don't know if I can call it a condition. Yeah. You spoke mostly about the medication, and this is the point I want to ask Doc. But also for our viewers, I don't know if Mr. Nyirongo has mentioned that if you have any questions whatsoever, you can just write them in the comment section, and they will be brought down to Dr. Lambwe, who will try by all means to answer. Yeah, regarding the medication, doctor, I don't know if you can just highlight to us and obviously the viewers, is there a cure for for lupus, and what measures does one take to contain it?
Okay, thank you very much, Mr. Nchito, for that beautiful question. Lupus doesn't have a cure. Okay, even though it doesn't have a cure, it can actually be controlled so that one is able to lead a normal life. Okay, as Abigail has mentioned, sometimes you have flares. By flares, we mean that the symptoms, okay, they actually worsen, and especially if one stops taking medication. So how the disease is controlled is by consistently taking medication. And the drugs that people take, if you get two patients with SLE, they'll not necessarily be taking the same drug. They'll be on different drugs depending on the system of the body or the organs that are affected. Okay, so the disease can be very much controlled so that one is able to lead a normal life. And we really insist that if the doctors have diagnosed the disease, one must consistently take medication and then honor the appointments that are given so that time and again, doctors are checking for complications that might be there or even adjusting the dosages depending on how one is actually responding. So there is no cure, but the disease can be controlled. Think of someone who is hypertensive. You don't say that because my BP now is normalized or the sugar is normal, and so I should stop taking the anti-diabetic medication or I stop taking the antihypertensives. Even when the BP is normal, you still take the medication. And the same applies to SLE or lupus. If you have lupus and you're on medication, whatever drug it is that the doctors have prescribed, it must be taken every day at the right time, following the instructions that the doctors have given. Thank you.
Thank you so much, Doc.
Maybe, Mr. Nchito, before you chip in, Doc, an interesting part is most of the patients are talking about the diagnosis and the cure. Most of the patients that have interacted, or those, may their souls rest in peace, that have died out of lupus, they have mentioned critically that just like it was with us, our experience is that when we went to the hospital, and just like she mentioned, that the diagnosis that these patients were being given was not the correct one. Would you highlight us if we have a lot of medical personnel who know also about this disease? Because that has been the experience. Even as it was the same. I think the time that the diagnosis came, it was in the late stage where our sister was in a very, very bad shape. Would you just give an overview if we have medical personnel who also understand and know about this disease?
Okay, thank you for that question, Mr. Nyirongo. So the people that understand the disease are there, just that lupus tends to be problematic in the sense that it's a great imitator. There are so many diseases that lupus can actually imitate. Okay, sometimes you feel like you have malaria, for instance. Okay, you present with fever, and when you have fever in our environment, obviously you're not forgiven for not thinking about malaria. So people do a malaria test, and if malaria is negative, some people still go ahead and give you the medication for malaria when in fact you don't have malaria. It can, for instance, mimic tuberculosis. Okay, if the lungs have been involved from this lupus that someone has, then you present with respiratory symptoms, you are coughing, you have difficulties in breathing, you have chest pains, and so people might think that what you have is TB. And in fact, there are some people who have lupus who have actually been given medication for TB, when what they have, in fact, is not TB. It can mimic like HIV, for instance, the manifestations of HIV, okay? But then the beauty with HIV that you can do the test and know that someone doesn't have HIV. They have to repeat the test after 3 months to ensure that the HIV is really not there. So it's a great imitator. So it imitates so many diseases, some of which I haven't even mentioned. Diseases like rheumatoid arthritis, for instance, lupus can actually mimic it as well. So that to make a diagnosis of lupus, one must really be alert. You need to think about a disease condition in order to diagnose it. If you don't think about it, you can't diagnose the disease. And so there are these things that are there in terms of symptoms and signs that are there in the patient, which will make a doctor start thinking about lupus. Most of the times, if you see a rash that is characteristic, as I mentioned, okay, like butterfly on the cheeks, okay, across the nose, okay, there is fever, there are joint pains, then people will think about lupus and investigate for it. You look for these chemical substances that we call antibodies that are targeted against one's cells. That is just a basic screening point. We call it ANA or antinuclear antibodies. That is what doctors would actually do to try to make a diagnosis of lupus. Over 90% of people that have lupus, when you do antinuclear antibodies, it is positive. So it has a high sensitivity, but the problem is that it is not specific. Once you do the test and it is positive, then you want to do some other tests so that you try to confirm the diagnosis. You try to do some tests that are actually specific for lupus. So the reason why it is not diagnosed most of the times is because we're not just thinking about it. If you think about it, you do some tests, then you find that a diagnosis is actually made. I need to confess that sometimes even 2 to 4 years can actually pass before the disease is diagnosed. The patient is just being given labels for diseases that they don't actually have, or people are just treating and trying to manage these syndromes that someone is presenting with, while the basic underlying disease that is there is lupus. And because people haven't thought about it, they have not diagnosed the disease. And so when a patient is presenting, they're actually presenting with complications, and these complications can be anywhere. The complications can be at the level of the heart, for instance, or it can be the kidney, it can be the brain, it can be the joints themselves. Really, so many complications that when one can actually have, including, the hands becoming whitish initially and then bluish, and then before you realize someone is even having sores on the fingers, they become gangrenous, which becomes an indication for even amputating to save life of an individual. So it's really because of not thinking about it, that's why we do not make a diagnosis of the disease condition. In terms of the people that can manage the condition, many can actually manage, but then where it is beyond the people that are seeing a patient, they can refer to a place where they have physicians, or better still, even people that we call rheumatologists. Rheumatologists are medical doctors that are specialized in the treatment of diseases that affect the joints, and SOE is one of them. Thank you.
Well, thank you so much, Doc, for that. So you know that May is actually Lupus Awareness Month, and us as organization trying to raise more awareness about it. What would you advise? What way or what route would you advise us in terms of networking with the medical doctors on how, like you have said, that when people go to the hospitals and they've got all these kind of symptoms, that lupus should be one of them to be diagnosed. How, according to your own understanding, How would you advise that we go about this in terms of engaging with the medical professionals, and you yourself as a medical doctor? What role are you going to help us to play in making sure that this disease called lupus is made aware? People know about it, including the doctors.
Okay, thank you for that question again. So the most important thing, I think, is to just be aware that lupus is a disease that is common and found in almost any part of the world, especially where you have people that are the blacks, okay? It is more common in blacks than the whites. So in people that are black, you find that the disease is much more than the white population. So it's a disease that is common, and we really have to think about it. And to think about lupus, I think it's really the symptoms that one must have in mind. So that if someone has been coming to you time and again, okay, you have looked for all these infections, we need to know that there's such a thing as the non-infectious causes of fever. In other words, it's not everyone who presents with fever who has an infection. There are non-infectious causes of fever, and SLE or lupus is one of those diseases that can present with fever. So if someone is presenting fever for very long periods of time, and people have done all sorts of tests, and they are not picking up the cause for that fever, we need to think about lupus, because it is a possibility, though there is such a thing as diagnostic criteria that has been revised so many times, okay, things that one needs to look for to say that this is lupus that I'm actually dealing with. But the fever is just one of them. Someone who comes in, apart from fever, there is a rash, okay, especially a rash that is made worse in sunshine. Then you know that most likely you could be dealing with lupus. But apart from that, someone who presents with joint pains, okay, that as well could be due to lupus. So that when you have this in a patient who has been chronically ill, it's good to actually think about lupus. Or even patients that come with what one thinks that it might be TB, you've done all the tests for TB, they are negative. Okay, things like chest X-ray don't help much, because the abnormalities that one sees on X-ray, time and again, people are accused of having TB when in fact what is there is not TB. It may just be lupus if the other things are actually there. So what I'm saying is that for the healthcare workers, they really need to be thinking about it, okay? Take history from this particular patient, the way that we have been taught, examine this patient, and then do the most important tests to see whether or not this particular patient has lupus. So it's really thinking about it, and when you think about it, investigate for it, and you find it, and then you treat it. We need to mention that lupus is not because of witchcraft, or we start thinking of who we should blame because someone has developed lupus. It is because, as we mentioned earlier on, the genes that someone has which predispose this particular individual to lupus, and then interaction between these genes and environmental factors, okay, which at the end of the day bring about lupus. So that at the end of the day, what you have is a situation where the soldiers of the body begin to attack the cells of this individual. Someone has given this example that you think of this vicious dog that you have bought so that thieves really chased away from your home. Instead of this dog attacking thieves, there's confusion. It starts attacking you. You who is the owner of this particular dog, you are the one who is being attacked. And so SLE, that is what it does. It's a disease that is common. And as I've mentioned, we need to think about it. so that when we think about it, then we can actually diagnose the disease. It is multi-systemic, as we have mentioned. Almost all the systems are affected. Okay, I didn't go into the actual presentation if a particular system is involved, but what I want to mention is that it's because of the multi-systemic affectation that the disease might actually be missed. For instance, if it is affecting the heart, you may have someone presenting with what we call pericardial effusion. Pericardial effusion just means that the fluid that is surrounding the heart. There was a time when one has pericardial effusion, you would not be wrong to commence TB medication. But now we know that the causes for fluid around the heart are actually so many. TB is just one of them, but SLE can actually do that as well. Sometimes you may have a certain type of inflammation of the linings of the heart, what we call endocarditis. Okay, again, when you make that diagnosis of endocarditis, you want just to concentrate on treating the heart. You forget to look for what may have predisposed someone to having that inflammation of the linings of the heart, what we call endocarditis. Okay, similarly, if the brain is involved, you think that someone has this confusion, you even send to the psychiatrist because you think that someone is mad, but the cause for that madness, so to speak, is actually SLE, and people don't think about that. Okay, if it is the blood that is affected, okay, the tiredness time and again is because of the anemia that is there. The HB for this particular person is actually very low, and so they are tired because the body tissues are not getting adequate nutrition. The oxygen that is getting there is very much reduced, and so someone is actually presenting with tiredness. So that if you think about SLE, you actually do some investigations and you make the diagnosis. Time and again, we see that someone is putting on a lot of weight with the fluid accumulating all over the body. They wake up early in the morning, they find that the face is swollen, the whole body is swollen, and you might think that it is kidney disease, but then if you don't investigate the cause for that kidney disease, then you miss out on SLE. Because of the many systems in the body that are affected, the many organs that are affected, the way people approach the management of the patient is to treat these individual systems and forget that there might be SLE that needs to be investigated for, so that when it is found, then the medication can actually be commenced in this particular patient. So let me pause here for now. Thank you.
Wow. I think we can write a book about that, eh?
Yeah. No, that's why we are recording, so that we push this.
Yeah. So you see, one of the most important thing why we are having this is not to put fear in people or to make people get depressed from this condition or disease, but so that you know exactly what you're dealing with, and by knowing, you can easily manage it. I think doctor has mentioned several times, like, look, the most important part about it is knowing what you're dealing with. Once you know, it's easier to maintain it. It's easier to actually even go through it. And like mentioned by our CEO, we actually got to discover lupus at its late stage for our system. And because it was at its late stage, I think when he was mentioning about the hands, I remember that time when it reached that stage, and it was almost at that time when the doctors would now sit down and say, look, I think let's look at this condition called lupus. But this is why we're here, to raise awareness for those who actually may be experiencing such, that early diagnosis is the way to go. Doctor, you had mentioned something about it's more prone to women or females than men. Now, my question to that is that I'm now looking at the children. So, is it what happens? Can they give birth? Can they transmit to their children? What is the answer to that question?
Maybe Doc, before you chip into that, because it's one of the other questions that we wanted to ask you. Also, as you are answering that, you can highlight also for couples who are married. As Mr. Nchito has said, can either a woman who has it, can it transmit to the husband or vice versa? Maybe you can tackle that so that it's combined together. Thank you.
Okay, thank you, Mr. Nchito and Mr. Nyirongo, for the most beautiful questions that you are asking this afternoon. Maybe starting with the second question first, whether a husband can transmit the disease to the wife or vice versa from the wife to the husband. As we have mentioned, SLE or lupus cannot be transmitted from one spouse to the other. It's basically a disease that has genetic predisposition combined with the environmental factors that we have mentioned, like sunlight or infections or hormones. So you don't have a situation where SLE or lupus moves from one person to the other. It doesn't happen that way. It's really the genes that make someone to be predisposed after interacting with certain factors within the environment. Okay. The question that is being asked about children having SLE, it is possible. Most of the times, as we have mentioned, it's the women folk that will have the disease, people of childbearing age, most of the times from around 15 years to 45 years, though people that are less than 15 or people that are above 45 can actually have the disease, but most of the times it's from 15 to 45, the child bearing age. And the estrogens or female hormones have a lot to play, to contribute towards disease. And we did mention that these genes are on the X chromosome. And if you remember in biology, the X chromosomes, females actually have 2 X chromosomes. And if you have these genes that are sitting there, then the chances therefore of having the disease is actually much higher. Then I need to mention that when someone is pregnant, or first before we even get to pregnancy, what we need to mention that before any patient who has SLE gets pregnant, they need to sit with their physician, they need to sit with the rheumatologist, okay, and mention that they need to get pregnant. Because if you get pregnant while the disease is very active, then the chances of bad outcomes for that baby become very high. Okay, you can have premature deliveries. Okay, we know that term, okay, a baby is mature if it is in the mother's womb for 37 weeks and above and up to 42 weeks. And so if one with lupus conceives while the disease is active, then it means that there are a number of problems that can be there, both for the baby and the mother. And so there must be this situation where there is planning between this mom and then the doctor to plan together, okay, and to see the levels of disease activity before one conceives, okay? So that if one conceives when the disease is not very active, then the chances are that the baby who is born may actually be normal and not have disease. But I need to mention also that there are certain antibodies that can actually move from the mother in pregnancy. If it's the first pregnancy, around 1 to 2% move from the mother and then go to the baby and then begin to cause problems in this baby. And the problems that are there, you can have lupus in the baby, or you can actually have the baby that is born with a heart that is abnormal, a heart that will have what we call conduction defects. By that I mean a baby who is born with an abnormal heartbeat because of certain antibodies that have moved from the blood of this mother through the placenta and to affect the baby. So if it is the first pregnancy, the rate is about 1 to 2%, but the subsequent pregnancies, it increases to much higher levels. It can even be as high as 17 to 20% when one is conceiving. When there is flare of this disease, the disease is not well controlled. And that's why it is important that one sits with healthcare workers so that they are advised on how to go about the same. Certain medications may actually be changed because we know that they're not supposed to be given in pregnancy and all that. So it's very possible that one can be born from a mother who has SLE or lupus and they have this disease because the mother conceived at the time when the disease was not very well controlled. So in short, what I'm trying to say that for someone to conceive, the disease must be very well controlled. If it's not well controlled, then the chances of complications both on the baby, okay, and the mother, very, very high. I'm sure you've heard of people who keeps on having one miscarriage after the other. If you have SLE, that is one of the conditions that might actually predispose to that. So that if a mom who wants to have a baby keeps on coming to the hospital because of recurrent miscarriages, then one of the tests that is recommended to do is just to check for lupus because it can actually lead to fetal loss. Thank you.
Yeah, I think before Kelvin comes in, you have talked about the suppressing the disease. Now, from my understanding, that I need you to correct me is, we're talking about the white blood cells, right? Who have now turned against the systems of the body and started fighting the body. So now, how does one now suppress that, or rather control the disease?
Okay, so suppression of the disease is through different types of drugs that are used, and all these drugs that we use are what we call anti-inflammatory processes. Okay, by anti-inflammatory, I mean disease that will lead to reduction in swelling, and there are so many drugs that one can use. But these drugs, okay, choice of the same is actually dependent on the part of the body that is actually affected. So to answer this question in short, I would say that there are many drugs on the market that can actually be given. Okay, the simple drugs are readily available in most of the district hospitals. You're talking basically about drugs like prednisolone, for instance, it's readily available. And then you give these antimalarials. Okay, there's one antimalarial that we call hydroxychloroquine. It's readily available in most of the places. Okay, but then there are some other drugs that are quite advanced. That one really has to do with planning. Okay, at the beginning of the year, you have an idea of how many SLE patients you're going to have, and so you prepare by having those drugs, or you have your register and you know the number of patients that you have who have this disease condition, and deliberately you go out to get those drugs so that they are available within the place where you see these patients.
Okay. Okay. Mr. Nyirongo?
Well, thank you so much, Doc, for that, and we really, really appreciate you coming on board. And this is an awareness on the lupus, that we are conducting today in honor of our late sister, Tina Nyirongo, who passed on after she had this disease. Doc, I think I've got two questions with me that have been asked on social media, but before we get to this, I just wanted to turn to our late Abigail. I'm sure you've also gotten a lot, Abigail, from what Doc said, probably things that you didn't know over the disease. I've seen you paying particular attention. I'm sure this is very, very important to you. So, what is your encouragement to people out there who have lupus? What would you say with what Doc has said? What would be your comment on that?
For me, I would like to encourage them to say they are not alone in this. And also that they should just accept it.
Good.
Yes. Accepting it, you will deal with it better when you accept it. Yes, mostly. I also want to tell them that they can do anything they put their minds to, and they shouldn't let lupus decide what they want to do or what they will do. They shouldn't let it decide for them, because they have the choice to decide. They have the right. Just because they have lupus doesn't mean they can't do anything. Yes, that's my encouragement.
Wow, I like those those words. I'd love to know, have you thought about a career that you want to pursue?
I have, but I'm also looking on the same, my condition, though I want to pursue medicine. Yes.
Okay, good.
Medicine, okay, I'm still thinking, I won't lie. Yes.
I'm sure with what we've had now, leading to awareness and everything, it will be good that you pursue something in the medical world so that it can help us to spread awareness on lupus. Yeah, thank you so much for that. Doc, we have two questions that have come in from social media. And the one, I think you tackled on this, but maybe it was not clear. The question is, like in Abigail's case, I think she mentioned about certain medication which are not accessible that she's on, like the steroids that she mentioned. So the question is, where can one find these medicines, like in Abigail's case, which she's taking? So do you have particular places where this medicine can be found? That is the question.
Okay, so thank you for the question, Mr. Nyirongo. So it depends on where one is going for health care. Some places might have the drug, other places may not have the drugs. But then also it depends on the kind of combination of the drugs that someone is on. Okay, many people, you find that they are only on prednisolone, for instance, and hydroxychloroquine. These are readily available. If you talk about methotrexate, okay, people that have SLE and they have, for instance, predominant joint involvement, you want to put them on methotrexate because it does them very good. You find that in some places it will be there, certain places will not have the drug. Okay, some people will be on mycophenolate. Okay, if you have involvement of the kidney, you find that you are on that drug. If you have involvement of the brain, then someone may be on azathioprine or you're on cyclophosphamide. Okay, so I did mention that it has to do with the place where one is obtaining care, so that sometimes they'll be available, and then the problem that is there is sustainability. Okay, they have them at one moment, then the next moment they're not there. And what causes patients sometimes to have poor outcomes is a situation where, there are these breaks that are there in medication, not the fault of the patient, but because of the patient is supposed to get the medication from, it's actually not there. And so you find that unfortunately, the patient cannot take medication as they would love to. And so you find that there are these flares. And what I would say, or to just advise, when people are doing planning for the care of these diseases, because they think that they don't have this disease until such a time that it is diagnosed, they have not planned for it, they have not bought these medicines that they can use for patients that have this disease. But for many, many places, tests have been done, and they've seen that the disease is there, and so there is a register for these disease that we call lupus. And so people must plan and ensure that these drugs are there. Okay, in the district hospitals, I did mention that the very basic drugs are actually there. Okay, drugs like hydroxychloroquine and prednisolone, and these ones relatively are much cheaper compared to the ones that we call these biologic drugs or the other immune suppressants, so that if they're not available in the hospital setting, then unfortunately one must get to these pharmacies or chemists and buy the medication from there. But I need to confess that they are quite costly.
Thank you so much. I think that was also Abigail's appeal. So these medicines are quite very, very expensive. And Doc has certainly hinted on how expensive these are. Now, Doc, I know this other question, the last one that has been asked, I know you mentioned it in the technical ways, where you say this disease is genetic, but maybe wanted to put it in simpler terms. The question is that, is there any possibility of the child inheriting or having the same condition? I know you mentioned it in terms of genetics and what, but maybe putting it in simpler terms, people want to know, is there any possibility of the child inheriting or having the same condition? Okay. For instance, Doc, us, our family, we may put it maybe in the brackets that are we at risk also because we had a sister who died of lupus. What would be your comment on that too? So you answer the question in a simpler terms. Is there any possibility of the child inheriting or having the same condition? That is a question that I've come, but I've added one more. For us who have had a patient, and also Abigail in her case, is our family at risk? Do we need to go and do these tests and whatnot? You can also tackle that one in your second aspect. Thank you.
Okay. Yeah, so let me think of putting it in a way that is simple. So if a mom has lupus, okay, there is no guarantee that even if the baby that is going to be born to this mother is going to have lupus. Okay, but the truth of the matter is that lupus runs in families. Okay, it runs in families. If there is this disease in this one family, the chance of people that are within that family having it is much higher than families that don't have the disease. Okay, that's how I can put it. So the chance is there, okay, that the disease can be there in this child who is born to a mom who has disease, especially if this child who is born is female, okay, because we have mentioned that the chance of having lupus, or the ratio rather between females and males, is 9-1. Okay, but then it doesn't mean that each and every mother who has a child, then this child is actually going to have lupus. It's not like that. I don't know if I'm answering the question.
Yes.
What's the other question now?
The other question, Doc, was that for a family like us.
Okay, yes.
Yeah.
Okay. So again, the fact that you had our late sister having lupus, okay, for the family members, the chance is there, especially for the females, okay? The chance is there, especially for people that are female, so that if one begins to have certain symptoms that we have already mentioned, then you do not delay in terms of trying to do the test, okay? You present at a hospital and say that this is what I'm having. Could it be lupus? And in fact, we had our sister, okay, passing on because of this same lupus. Okay, so the chance is there, but again, we can't say that definitely, okay, you guys, you must go and start doing tests because you may have lupus. That's not how it works. It's really looking out for the symptoms, because in this awareness, what we want to do is to make people know how the disease does present, so that when you know how it presents, even before you begin having complications, you present at a healthcare facility and tests are done, so that as tests are done, if the disease is there, then you are given medicine that is appropriate.
Thank you so much, Doc. Maybe to just jump in, I just wanted to find out, I know you've mentioned to say once you have the symptoms, but is it possible that even without symptoms, you're able to carry this test, or it's only when you're starting to feel the symptoms? Like for us who had this case in the family.
Okay, so without the symptoms, one may do the test. It might actually come out positive, but then what we call titers, or the levels of this particular antibody, might be not significant for you to think that there is disease. Okay, so the chances of it being positive if there are no symptoms is not that great. But when there are symptoms, you do the test, then the chances of picking a positive test becomes higher. That is a good professorial question.
Thank you, Doc. I think we are coming to the end of our podcast. We've actually eaten into the time that was allocated. I want to find out from Mr. Nchito if there are any questions before we could get to the closing remarks, which Doc must give, and our own closing remarks.
Okay. Yeah, thank you so much, Doctor. Thank you so much, Madam Chanda, and CEO. Yeah, I think it's been a very educative podcast. Also grateful to our viewers. But this is not the end for these questions. Doctor is available. And so what we can do is that if we have any questions whatsoever that you may feel might not have been answered by Doctor, you can easily just send us a direct message in our inbox, and we'll forward it to Doctor, who will give a bridge between you and him and respond to as many as we can. But for now, we are grateful, and thank you so much on my side. Over to you, CEO.
Thank you so much, Mr. Nchito, for that one. I will just go to Abigail before we can get to Doc. What are your closing remarks, Madam Abigail?
I just want to say thank you for the knowledge that I've learned because there's something that I didn't know and I've learned more today. And I'm very grateful to be here. I'm also happy that I can help in the lupus awareness today. So thank you very much.
Yeah. Thank you so much for those closing remarks. Doc, what are your closing remarks?
Okay, thank you very much, Mr. CEO. What I want to say is that lupus is real. It exists. There are many patients in Zambia that have the disease. And so to the patients that have the disease, I'll just encourage them to continue taking their medication as prescribed. And whatever development they see in their body as a new symptom, people need to make sure that they present to a healthcare worker who can help diagnose what that problem is in association with lupus. To my fellow healthcare workers, I just want to mention that we really need to be alert, especially when a patient keeps on coming to us. It could be that it's lupus that they have, and we are not just thinking about it. So that if we think about it, then we are really going to make a diagnosis for this problem. Someone has said that fever plus rash plus joint pains, think lupus until proven otherwise. Thank you, Mr. Chair.
Thank you so much, Doc, for those closing remarks. We want to once again thank the panel for this awareness that we've started today as we are celebrating the life of Tina Nyirongo, who died on this day around 16 hours at the University Teaching Hospital. But more especially, we're grateful to Dr. Lambo, who has been with us today. He has taken time out of his busy schedules. But it's also good to know that in our last days, Dr. Lambo was always there for Tina, and we ran around with him, and we're grateful that he's been with us today. And this, as Mr. Nchito has mentioned, is the beginning of this awareness. For the past 7 years, we've been mourning our sister, but we thought we could move out and celebrate her life. And this is the best way. Even herself, if she was around, should have wanted us to celebrate this lupus awareness. Should have been an advocate. You know, she loved to do such things. But we're also grateful to her because we are doing this as part of the foundation. She was a key figure in the foundation when my brother and I were thinking of the ideas of this foundation. Tina was part of it, and she made sure that most of the ideas that were being put together, she was there. We spent late nights together to see this foundation come into light, and that's why we're here today. So we'll be proceeding from here at Chilawombwe Secondary School, where she started a teaching career, where we've been availed some piece of land where we're going to do the tree planting in honor of her. And also it's one of the places that we are going to be presenting awareness on lupus during the tree planting, and then also many other days that are to come in terms of this awareness. But we are also glad that the foundation has named the project that we are running under the Skills Training Center in Lusaka, in partnership with the Turkish Embassy. We have named it Tina Nyirongo Skills Training Center in honor of her. And it's also part of the initiative that we are going to use in order to continue to run the awareness on lupus. So I hope this has been helpful. We want to save more lives. We couldn't save the life of Tina, but it presents us an opportunity as human beings, not just to sit, but to continue advocating for this disease that is rarely known among many of the people in our community. So we want to thank you for tuning in, and we're grateful that you've been with us, and we are excited to have come to a close of this educative program. Thank you.